مساء الخير. Good afternoon. Thank you for inviting me for this conference. I'm very happy to speak in front of my colleagues and my professors. My special thanks is for Dr. Iman Sanat. She's my professor and my mentor, and I hope I can give you something new. This is what I'm calling the pelvic floor muscle gym. We are all talking today about the vaginal rejuvenation on the level of the mucosa and subcutaneous tissue. Yet I'm trying to make it more difficult, and we will talk about the muscles. I'm an associate professor in Maine University and a fellow of Yale University in USA. So the muscle floor, the pelvic muscle floor, is very important because it supports the pelvic organs, which is very important for the retention of urine and feces. It contributes for the stability of our bodies, and it's important for the sexual experience. My points of discussion is how we can use the functional magnetic stimulation, which is it's not a very new era, but it's a very nice one for treating the female urinary incontinence, female sexual dysfunctions, and male sexual dysfunction. Female urinary incontinence, as everybody said, it's a big problem, having like 40% of the females around the world, and 33% are under the age of 40, and 50% under the age of 60. It's very common, and nobody talks about it, nobody complains about it, and they take it as an aging process, normal process of an aging process, and usually females do not come even to the obstetricians or the gynecologists asking about this problem unless it is very, very stressful for them. So we have a lot of symptoms that interferes with the style of life, the daily activities, and then we have many types of urinary incontinence. So the stress incontinence is the most common, and there is a lot of leak of droplets of urine during daily activities. And then we have the urge incontinence, which is more distressful, and it occurs very common in older women. It's not very common in young age. What about the FDA? In 1998, the American FDA gave the functional magnetic stimulation, which is kind of waves that leads to muscle contractions and strengthening of the muscles. They gave them the approval as a method of treatment of urinary incontinence because it usually starts with stimulation of nerves and then muscle contractions. These rhythmic contractions and relaxation is some sort of exercise for the pelvic floor muscles. There is a lot of data about this and a lot of mechanisms. So it's simply going to stimulate the sacral nerves, which provides some autonomic and somatic innervation for the lower urinary tract. There will be contractions and relaxations, which is very rhythmic, and it would lead to control of the pelvic muscles and controlling of the function of the pelvic organs. In stress incontinence, the target is the external sphincters and the pelvic floor muscles, but in the urge incontinence, there is two types of mechanisms are working. First is stimulation of the pudendal nerves, so decreasing the detrusal muscle, detrusal reaction or inhibition, and stimulation of the efferents, which leads to increase the muscle tone of the urethral sphincter. These are a lot of researches starting from 1999 till 2017 favoring the use of functional magnetic stimulation in the urinary incontinence. Even in the Dutch Urological Association is using this technique now for the stress incontinence, and it is the first choice for treatment. So it's very important to start treatment as early as possible because this will affect the results, and it is non-invasive, very simple. Like this is the machine I'm using in my clinic now. I'm not using it for the female urinary incontinence. I'm not a gynecologist, but I'm using it for the male sexual dysfunction, and as I will show you, and the female sexual dysfunction to complete the cycle. So in our clinic, if somebody is coming for vaginal tightening, we have CO2 laser, we have erbium laser, we have RF, and now this is all for the mucosa, and we don't have HIFU yet for the subcutaneous, but nobody worked on the muscle part, the muscular layer of the vagina. This is what we are working on now, the muscular layer. So this is simply the female sits with all her clothes on. She sits on the chair, positions herself. There is a probe under the chair. She positioned this probe in between the vagina and the anal sphincter, and then we start the program very simply as we increase the strength as much as she can tolerate, and then these rhythmic contractions are non-painful, and after 4 sessions she begins to feel the difference. We make it like 2 sessions every week for 20 weeks, and there is nothing there. There is non-invasive procedure. She's not taking out her clothes. She's not sleeping on a bed. She's just sitting on a chair, and she feels the difference as well. This is the efficacy. 84% of the women of stress urinary incontinence, they are completely dry after finishing the sessions. 91% from urge incontinence, they are always completely dry, and from the mixed 95%. And even versus the Kegel's exercise, we have a very nice result compared to Kegel's exercise. And the frequency of protocol of treatment is different from the type of stress incontinence. The machine is very easy. They have the stress incontinence protocols, and they have the urge, and they have the mixed. Even we use the machine in other things that I will show you. 2 to 3 sessions per week, up to 20 sessions will be enough, and maintain the efficacy for 1 year. Like 1/3 of the cases, they stay dry for 1 year. This is the maintained efficacy in some studies, 81% of the stress incontinence and 53% of the urge incontinence up to 24 weeks, 2 years. Again, this is the chair, and I will show you something, a very small, very short video about the statements of the patients that used it.
Wow.
So yeah, it was almost addicting.
Good. As far as your bladder, what improvement, like say...
This is the sound of the chair working in the background.
I would say at least 10%.
So she's speaking while she's sitting on the chair.
So tomorrow I'll try to get on the track and see if I can, run.
Okay.
But usually it's when I'm running or jump roping or sneeze. So it's the, I can't remember what it's called.
Have you sneezed today yet?
No, I haven't, believe it or not.
Oh, we have to make you sneeze.
Yeah, I know, huh? To test it out. No, it's been great. This is amazing. This chair is absolutely amazing.
What brought the idea to my mind was this second video. This man is, he has a pain in the back. He used the chair to support the pelvic floor muscles, and he said that he's feeling better in his sexual life. So we got the chair and tried it on the male sexual dysfunction.
This thing that one time, only going up to 3, I'm like brand new. It does not affect me. I walk to work, I run back home, I'm good, and my wife has actually seen a difference as well. It's actually,
can use this?
Something that's kind of crazy.
She used the chair, or she sees...
Being on my feet all day and working, that when I got home, I'd be so fatigued that my legs actually hurt behind my knees and my thighs, and I'd get up just like not even wanting to get up. Since I sat in this thing that one time, only going up to 3, I'm like brand new. It does not affect me.
It's not
I
seeing
walk
on
to work, I run back home, I'm good, and my wife has actually seen a difference as well. It's actually been something that's kind of crazy.
She used the chair, or she sees a difference in you?
She sees a difference in me.
Okay, so this is the muscular part we were talking about, and so we got this idea from here. There is a big difference between the male and female pelvis. Actually, it is some sort of different muscle orientation in some parts. So from this point of view, we tried it on the male sexual dysfunction. We are targeting the pudendal nerve in the male as well. For the retrograde ejaculation, it was like our first success, because we have a lot of problems with these patients of type 1 diabetes where they don't have control on their ejaculation, and we usually need to go for operation for these persons to treat the infertility problems. After using the chair and strengthening the muscle floor again, people are regaining their ejaculation one more time. They are regaining the ability to impregnate their wives, and even still they have some problem or some grade of retrograde ejaculation, but we have a lot of success with this. For the erectile dysfunction, because we need also the nerves and we need also the hemodynamics, theoretically we thought it would work, and we did a master thesis about this. It's very, very nice one in these indications for erectile dysfunction, the psychogenic, the unexplained, the non-responders for Viagra and similar drugs, for the controlled diabetes mellitus and the mild venous leak. And then even the hemodynamics are increased according to this paper. So our take-home message: strong pelvic floor muscles is essential for the sexual and asexual function in both males and females, and FMS is the only nowadays method for training and strengthening of the pelvic floor method without in non-invasive procedure. Thank you very much. I hope I gave you a nice thing. Thank you.